Welcome, my friends, to Dr. Frank Cutting Edge Medicine. I'm your host, Dr. Frank Miller, and I had something exciting happen today. My computer cut off in the middle of my recording, so instead of a new recording today, we will replay last week's interview. Since it is still Lyme Disease Awareness Month, we'll have a talk with Kim Engelman again. But first, happy Mother's Day, and be sure and thank God for our mothers and all the important women in our lives. I have two quick announcements. First, tomorrow, Monday, May 9th, I will be the guest of actor Colin Egglesfield on his Facebook Live Coffee with Colin segment. So friend Colin Egglesfield can watch our discussions about health and wellness at 7 p.m. on Facebook Live. Second, this week I will be attending the American Academy of Ozone Therapy meeting, so I should have lots of new information for you next week. You know, what we do in this clinic are things that can help you when conventional medicine seems to have hit a roadblock. And today we're going to talk about a couple of those very difficult conditions to handle, some that are related to COVID, either having the vaccine and a side effect from the vaccine, or perhaps a side effect from COVID itself. And also, since it is May now, May is Lyme Disease Awareness Month. We're going to talk some about Lyme disease. So before we get going, let's say a prayer since it's Sunday. God, thank you for the gift of good health, which we so often take for granted. And thank you for revealing new and effective remedies for when we get sick. Open our hearts and our minds to the knowledge that we need to stay healthy. In your name we pray. Amen. So today, I'm happy to have a guest, Kim Engelman, who you have heard me talk about a lot on this show because she is the one who runs the clinic over here. She's the nurse practitioner that fortunately joined with me, how many years ago? 4 years? 5 years?
6.
6 years. Time flies when you're having fun. All right, so, and we're going to be talking a little bit about neural therapy today. First, we're going to try to figure out what it is. I know less about it. Kim went and got trained, and she's going to tell you a little bit about how she got trained and what it is and what it can maybe help you with. So here you go, Kim.
Hello, Dr. Frank.
Mm-hmm.
So neurotherapy is one of the collection of injections that we do at O3+. I like to mix different modalities, as you do, to get the maximum benefits for our patients. And I was very lucky early on in the clinic that one of my favorite patients flew down her naturopath from Seattle so that he could teach me the injections that she so dearly wanted. And I was lucky enough that one of those injections is the kind that we are using on patients post-COVID. That nice doctor's name was Dr. Jeff Harris. He's a naturopath up in Seattle. He gives classes on neurotherapy. So I've been fortunate enough to be trained by him. He is now a mentor of mine.
What's the difference between a medical doctor and a naturopath? Do you know?
I believe that naturopaths are trained more in root causes than medical doctors are. They use a lot of homeopathy. They use a lot of hands-on treatments. They also use a lot more herbals. I do find that when more and more doctors are discovering the term functional medicine,
right,
that's often what naturopaths have been doing for hundreds of years. And
of note, in different states, some naturopaths can practice and some can't, and I believe Texas does not recognize naturopaths' licenses.
Correct. Texas is a no-license state for naturopaths, so I believe in Texas they can give dietary consults.
Yes, but in this case, they can come and educate us, and under my license, we can do anything that the patient authorizes us to do with full informed consent. So I want to remind everybody that some of the things that we talk about here are not FDA approved. They may not be approved to diagnose, treat, cure, or prevent any disease. And when you come for a treatment here, you sign a consent form that says that you recognize that and that we have told you about other ways, conventional ways to treat your condition, and also what we expect the benefit and the risks of any procedure that we do here to have on you. Again, we only do stuff that we think is going to be safe and effective for you. We try it on ourselves most of the time first. So it's not like we're doing, voodoo medicine or anything weird here. These are things that have been done in other countries and are certainly done in other states by licensed professionals in other states. And we're trying to bring things to Texans that can maybe help them get to feeling better and be in the best health and wellness condition that they can be in. So let's go back to what neurotherapy, and it sounds like it has something to do with nerves.
Yes, back to other countries. Dr. Dietrich Klinghardt is the American master who brought the neurotherapy from Germany. So yes, neurotherapy is resetting the nervous system. We are realigning the autonomic nervous system with the sympathetic nervous system.
Okay.
Something that most people in Texas and America aren't as familiar with as others is the term of interference fields. Interference fields are issues in your body that can be brought on by inflammation, trauma, disease, anything that shocks an organ or a tissue.
Okay.
So that could be COVID. It could be the vaccine. It could be anything that makes the tissues not happy.
So would that be like, we've talked before about having the Chinese meridians and electrical activity flows along the different Chinese meridians, and that also goes through teeth, and if you have a bad tooth, that could interfere with that.
For sure. A bad tooth is an interference field.
Okay.
Procaine is used, and neurotherapy is used on bad teeth.
Tell us what Procaine is.
So Procaine is the main ingredient of neurotherapy. Procaine is what we are injecting. Procaine was first synthesized in 1905 when the anesthesia, or when the doctors were looking for an anesthetic that wasn't as addictive as cocaine.
Oh, well, that's good.
Correct. So they discovered Procaine. A lot of y'all have heard of something similar to Procaine as Novocaine. The difference between Novocaine and Procaine is Novocaine has a sulfide preservative added to it. Some people are allergic to that sulfide preservative, so that's kind of why Novocaine isn't used as prolifically as lidocaine.
Okay.
The issue with lidocaine, though, is that it is not friendly to mitochondria. And it's all about the mitochondria nowadays.
So we talked about mitochondria being important for energy production. So the Procaine gives you anesthesia, but it does more than that, and that's what you're going to explain about the neurotherapy.
Sure. Procaine has been, through research, because we do like research here at O3+, it will relieve pain and reduce inflammation. It will reduce fever. It will reduce allergies. It will repolarize the cell membrane. It will increase mood by decreasing serotonin oxidation. It's a vasodilator, and it also stops bad sodium from going into the cells. So we're using it both for the anesthesia and for resetting at a cellular level, detox.
So what I had heard at a conference was it was important with that repolarization of the cell. And if the cell, what that means is that you have to have the proper charge on each side of the membrane of the cell for the cell to function properly. For example, a nerve fires by having an influx of ions and a change of that polarity going up and down the nerve. And so here we're talking about if you've got a problem that is somehow mediated by a nerve, then this Procaine injection done the right way may be able to help you. So how have you seen it help?
I've seen it help in many ways. You can do it into a scar, and not only would it make the scar look prettier, but it stops the adhesions and it can stop pain. My best results with that is a 70-year-old woman with bilateral knee replacements, old school scar going up her knee, couldn't go up or downstairs without pain. I injected Procaine into her scars twice, 2 weeks apart. She no longer has any sort of pain or irritation going upstairs. So
I think that's an important part or point of neurotherapy. The actual action of the anesthetic is only maybe 4 hours, 3 to 4 hours, and yet this lady got benefit that was long-lasting because it reset her nerve, right? That's
exactly how neurotherapy started. They realized that they were having lasting effects post the anesthesia. I can also do injections over an organ, and people also do injections into trigger points. The trigger point injections are the reason we're speaking of the neurotherapy today, Because there are trigger point injections with the neurotherapy that will calm spasming of lungs. So people who are not able to get a deep breath, people who excessively cough, people with pneumonia, people with asthma can be calmed with neurotherapy injections into a trigger point located in their back.
So this trigger point is, you know, where you have your wing bone, your scapula. It's kind of medial of that.
Yeah, infraspinatus. So it's on the medial aspects of your scapula. Mm-hmm. You can kind of feel around for a tender spot, and some people are tender in that muscle. The gentleman that invented these injections in the infraspinatus, he noticed that all of his patients who had lung issues were sore in that muscle. And then he decided to start injecting that muscle, and then lo and behold, he's got research for 8,000 different patients helping him.
Wow. I think it's fascinating that a trigger point on the skin affects an internal organ.
Fascinating. That's neurotherapy.
Yeah.
It's all connected. We are a series of connections.
I mean, that's similar to what people always said with acupuncture, acupressure points, all those different things that, you know, the skin is an amazing organ with basically little sensor buttons on it. If we can stimulate them in the right way, you can affect changes, you know, in your gut, in your lungs, even in your heart rate, different things like that. It's pretty impressive.
And who would have come up with that you can inject in your back and get results in the lungs?
So you've had folks who have had COVID that were short of breath, and that seemed to help them?
Yes, I have one patient that believes she had COVID twice. Mm-hmm. She's a teacher. She was overjoyed when she was offered the Johnson & Johnson vaccine, and from the point of 2 days after her vaccine for weeks, she was short of breath, very fatigued, muscle and joint pain.
Wow.
So we bring her into the clinic, and first thing we do here is injections. If we're going to do IVs, we like to do the injections first. By the time she got into the chair for the IVs, she felt that she could take a deeper breath.
Wow. So that was just minutes.
Minutes. We have a employee here that tends to cough quite a bit. She had one more cough 20 minutes after the treatment, and then she didn't cough all night. And now I can't even find tenderness in her back.
So much better than a narcotic cough suppressant.
Lasts much longer. And yes, I need her sharp when she's working.
and non-addictive.
Yeah. Non-addictive. So I do neurotherapy all over the body, but the one I'm most excited about is the infraspinatus for the lungs. The patient did have some not complete recovery of her months-long symptoms from one treatment, so I saw her 3 weeks later. We did the injections again. She got many IV therapies here, and she feels she's back to normal now after her post-COVID vaccine symptoms.
That's great. So, you know, sometimes, I guess in traditional medicine, if you had that symptom, we would put you on an anti-inflammatory, maybe a muscle relaxant.
Steroid inhaler.
Sometimes a steroid injection into the trigger point. But all of those things have more side effects.
Correct. My patients normally do not like steroids. Mm-hmm.
Because they lower your immunity. Yeah. So pretty impressive. What else do you have as far as neurotherapy? Have you done any, were you doing that around the eye, or was that something else?
That's something else.
Okay. So, mainly
I've treated migraines with neurotherapy.
Where do you put it?
They call it the Ring of Thorns.
Oh, like a crown of thorns.
Crown of Thorns. It's called the Crown of Thorns. So literally I do surface injections of the Procaine just north of the temples, all the way around the head.
It sounds like it might be a painful injection, but it's not.
People tolerate it better the second time. I think people have anxiety on how much injections will hurt. Once they get the first one, they realize it doesn't hurt that bad.
Because you use a small needle.
27 gauge 1/2 inch for the surface ones, and 27 gauge 1.5 inch for the deep ones.
Yeah.
So very small.
Back to the scars for a minute. You know, again, if you if you know anything about the Chinese meridians, when we were in medical school, the surgeons didn't really talk necessarily about cutting across Chinese meridians. We just tried to go along the skin lines, and sometimes those work with the Chinese meridians, and sometimes they just totally bisect them and really messed up the flow. And that has been a source of post-operative pain for a number of patients. And yeah, there have been a lot of documented cases where you just inject the Procaine with the neural therapy into the scar, and it calms down the nerves and does it permanently. Pretty impressive.
Yeah, one of the ones that Klinghardt taught me that I've used the most is in the neck area on either side of the carotids, and that works really good post-whiplash, as well as people with brain fog who feel they're not getting restful sleep to detox the brain. And it opens up the channels to be able to detox the brain. Klinghardt's beliefs on whiplash is that the nerves get overstimulated in the front, all the blood goes to the front. That's why 4 months later you've got pain in the back of the neck, because none of the good blood's going to those muscles. So if we treat the neck at the beginning, soon after the offending accident, they never get the pain of the whiplash. Obviously, if you're poking a needle around the carotid arteries, you should be trained to be doing this. So do not do this at home. And again, give us a call, 210-558-7778. And Kim can evaluate you, see what, if neural therapy will help or which one of the treatments that we have here might be able to help you. So, so that covers the COVID bit a little bit. You know what, we're, just an aside, you know, I'm curious why India is having such a challenge with their COVID surge now. We had talked probably back in January that they were using ivermectin to help prevent COVID, and I'm not sure they're still using it. I was trying to find that out, and I was blocked by Google for even finding out if ivermectin was being used in India anymore. It on a different search engine, it sounded like under the instruction from the FDA, they were recommending not to use it, and I'm just curious if that might be part of the cause for the surge in India. They need something over there. Fortunately, we're going to try to help them out with oxygen and vaccines and things like that. So also there's been a lot of my patients, kind of like the rest of the country, you know, probably 3/4 of the people are getting vaccines and the 1/4 says they're pretty sure it's a conspiracy. It's up to you whether or not you want to get a vaccine. I just will mention that if 170 million people have had the vaccine, and at least in the short term, they're not all dying, it's probably not quite as dangerous as the conspiracy theorists think. But we don't have the long-term studies. And I had a lady the other day say, what about my daughter who's 24 and planning on getting pregnant? And that's an unknown. Personally, I would wait probably 2 years, and if you could, and see what happens with the first round of babies after COVID injections, COVID vaccines, or COVID infections. The vaccine, you know, is against the spike protein. The spike protein is, we have a spike protein naturally to help hold the placenta against the uterus. And if you have an antibody against that, nobody really knows exactly what that's going to do. Could it maybe cause an increase in miscarriages? Nobody really knows. I really feel like most of the side effects from these vaccines are multifactorial. You know, if you can keep your body in good shape, you probably won't have a problem with any of the insults that comes your way, including vaccines. If you get an infection, I mean, we're going to morph into Lyme disease here in a moment, but, you know, Lyme disease is caused by a tick-borne it's a tick-borne disease, and I've been bit by a lot of ticks, and I didn't get Lyme disease, and yet some of my buddies have been bit by ticks, and they did. So why is that? And it probably has to do with the individual's immunity, which some of that is inherited, some of that is lifestyle, and also other things that weigh down your immune system. Like Kim mentioned a minute ago, it's all about the energy made by the Krebs cycle to make ATP. And if you have interferences in your meridians or anywhere like that, that uses up energy. If you eat the wrong foods, it takes more energy to digest them.
If you have a lot of toxins in your foods from maybe a lot of fried foods, and you have to get rid of those toxins, that takes up some of your energy. And then, let's say you get bit by a tick, and now you need a very strong immune system to ward off that tick. You may not have as much energy as you need to ward it off, and maybe it can get a foothold in there. So kind of an interesting idea. I think in general, the best thing you can do is stay as healthy as possible. So we talked about our 5 pillars of health. That's good sleep, good nutrition, regular exercise, de-stress, and detoxify. So we talked before about nutrition, and we're big proponents of grass-fed beef, if you're going to have any beef, free-range chickens. You don't want to have these animals. If you're going to eat an animal, it needs to be one that has not been contaminated by too much stuff in the soil or in their feed. And then mainly a lot of good quality vegetables, organic if possible. We're supposed to be having 6 portions of vegetables a day. If you watch what most people eat, they maybe get 1. I've been looking at the dietary history of a lot of my patients. Some of them don't have any vegetables for breakfast or lunch, except maybe 1 leaf of lettuce on their hamburger, perhaps, and then they have a salad for supper. So if we can have a little bit more vegetables, the vegetables have all those phytonutrients that really help our immune system. So that's that one. And sleep. Sleep's a big problem in this country for a lot of reasons. We have busy lives. We have cell phones. We watch TV. It's just really hard to turn everything off, but it's really important. So you need to make that a priority, because that really helps you. Like Kim mentioned, the brain has to detoxify at night, and so you don't want to have it clogged up with having to deal with a lot of sugar at night. They talk about having 3 hours before bedtime of not eating anything so that your brain can detoxify, but it also needs to be in good sleep at that point. So, and then your regular exercise. To detoxify, you need to sweat. And also, by exercising, you make more energy. Again, the actin and myosin fibers move back and forth, and they shed electrons. Electrons can drive your mitochondria and make more energy. And if you can't exercise, then you need to come by our clinic and get some ozone treatments, because ozone is oxygen with an extra electron on there. We stick 3 oxygens together with an extra electron, and then we administer it in different places. One of the main areas is major autohemotherapy. So with that one, we put an IV in you with a skilled IV therapist so it doesn't hurt you. And we drain your blood into a bag. We put it up right, and we bubble ozone directly into your blood where it binds to the double bonds in the plasma of your blood, and we give it right back to you. So now you have activated plasma, which can activate all the cells in your body and increase your mitochondrial production of energy, ATP, which again can drive your immune system, it can drive your healing, it can improve the function of every biochemical process in your body. And actually, they have good studies to show that it increases nuclear regulatory factor 2, and so that increases longevity and can help you with healing. So now we're going to move into Lyme disease a little bit. You know, one of the other things when we were talking about COVID, people had talked about whether or not that came from the Wuhan lab in China as maybe a biological weapon that maybe got out of their lab. And I know a lot of my friends were kind of upset about the Chinese if they were doing that. But, you know, there's an interesting book about Lyme disease. It's called Bitten, B-I-T-T-E-N. I'll tell you the name of it. The author here. It is Chris Newby, K-R-I-S, last name N-E-W-B-Y. And the name of the book is called Bitten, The Secret History of Lyme Disease and Biological Weapons. Now, this is about the U.S. Army, I believe it is, that maybe created Lyme disease. So I don't know all the truth to this, but she got a lot of her information from the researcher who actually discovered the causative organism of Lyme disease, which is Borrelia burgdorferi. So I'm going to play a little bit from the beginning of this book, and you can see if it might be an interesting book, especially if you know of anyone who has Lyme disease, and we'll talk more about Lyme disease in just a second. So here's the prologue to this book.
In 1968, there was a sudden outbreak of 3 unusual tick-borne diseases that sickened people living around Long Island South. an estuary of the Atlantic Ocean off the shores of New York and Connecticut. One of these diseases was Lyme arthritis, first documented near the township of Lyme, Connecticut. The other two were Rocky Mountain spotted fever, a bacterial disease, and babesiosis, a disease caused by a malaria-like parasite. The investigations into these outbreaks were fragmented among multiple state health departments, universities, and government labs. It's not clear if any officials were looking at the big picture, asking why these strange diseases had appeared seemingly out of nowhere in the same place and at the same time. 13 years later, in 1981, a Swiss-American tick expert named Willy Bergdorfer was the first to identify the corkscrew-shaped bacterium that caused the condition that we now call Lyme disease. The discovery made headlines around the world and earned Bergdorfer a place in the medical history books. As researchers the world over rushed back to their laboratories to learn as much as they could about this new organism, the two other disease outbreaks were all but forgotten. 38 years later, the conventional medical establishment would like us to believe that it has a solid understanding of the prevention, diagnosis, and treatment of Lyme disease. It says that the tests to detect Lyme are reliable and that the disease can be cured with a few weeks of antibiotics. The statistics show a different reality. Reported cases of Lyme disease have quadrupled in the United States since the 1990s. In 2017, there were 42,743 cases of Lyme disease reported to the Centers for Disease Control and Prevention, CDC. The scientists at the CDC who study the spread of diseases now say that the actual cases may be 10 times higher than reported, or 427,430 cases. On average, this means that there are about 1,000 new Lyme cases in the United States per day. While most Lyme disease patients who are diagnosed and treated early can fully recover, 10 to 20% suffer from persistent symptoms, some seriously disabling. One study estimates that Lyme disease costs about $1.3 billion each year in direct medical costs alone. But no one has assessed the full economic and societal impact of chronic Lyme, sometimes called post-treatment Lyme disease syndrome, PTLDS. Patients with lingering symptoms are often dismissed by the medical establishment, a situation that forces them to seek unproven treatments that aren't covered by medical insurance. Many are unable to work or go to school. Some go bankrupt. Families break up. There's a high rate of suicide among Lyme disease patients, reflected in a common saying among the afflicted. Lyme doesn't kill you. It only makes you wish you were dead. The chasm between what researchers say they know about Lyme disease and what the chronically ill patients say they are experiencing has remained an open wound for decades. This book begins with the premise that both sides are mostly right, and that the main issue is that we're viewing this public health crisis too narrowly, through Lyme-colored glasses. Before I started this book, I thought I had a solid understanding of the Lyme disease problem. As a former Lyme sufferer, I had first-hand experience with the disease and how the medical system fails patients. As a researcher for the Lyme documentary, Under Our Skin, I had investigated the politics, money, and human impact of the disease. And as a writer at a medical school working in a group that teaches scientists how to conduct unbiased research, I was familiar with the fault lines in our current medical system that can compromise scientific objectivity. It took the late, great Willy Bergdorfer to teach me how to view the problem through a wider lens, through a secret history of the Cold War, when Willy and others turned ticks into weapons of war.
That sounds very interesting. And I will say the book, it's on, I got it on Amazon. It's also on audiobooks. And, you know, if you want to read more about it or listen to it, it's a fascinating story. And, you know, we don't really have any truth. I'm sure if the U.S. government decided to make Lyme disease, they wouldn't tell you about it anyway. But she has some documented stuff where people would fly low reconnaissance planes over Cuba and dump a bunch of ticks in the fields so that perhaps it would help to topple Fidel Castro. This was all during the Cold War, and you know what they were looking for is, according to her, was some kind of a disease that would occupy a country so they wouldn't have enough energy or people to go invade anybody, and it would be hard to trace. So if that's true, first of all, Lyme disease was first noted in Connecticut, which happened to be across the bay from an island where they tested a lot of biological warfare agents. So it's possible that somehow the organism, if that was the case, it might have gotten across the bay, and maybe that's why it started in Lyme, Connecticut. And it's spread by ticks. And so what we want to emphasize during Lyme Disease Awareness Month is the best treatment is to prevent it. Don't get it in the first place. So we're going to talk now a little bit about how to prevent getting a tick on you. And, there's a couple of different insecticides that are out there. And the one that we're members of ILADS, which is International Lyme and Associated Disease Society. Now, there's two basic organizations that deal with Lyme disease. You have the standard physicians, what we've taught in medical school, that's the Infectious Disease Society, IDS. And they have specific guidelines for what constitutes Lyme disease. However, because if this disease was actually crafted, and even if it's not, it's one of those things that if you're sick and you draw a bunch of lab, it all looks normal. All the usual labs look normal. And yet the patient feels bad, and so what has happened is a lot of times they go to conventional doctors and they say, I've got all these symptoms, I have brain fog, I have fatigue, I have a headache, I have joint aches that move all around, and we check them for everything, and they say, well, all your lab looks fine, it must be in your head. And it's very frustrating for the people who have Lyme to have this because, the brain fog especially can be really incapacitating as far as trying to work. If you've got any kind of a job where you have to use your brain power and be on full speed all day long, it's really hard to focus. So, you go to another doctor, they get the old records, they look at all the results and say, yep, sure enough, it's all okay. And that's even including the Western blot test. So typically for most infections, we do antibody tests. And we look at different levels, and there's a special one called a Western blot, and that's what the CDC says is the test that you use. But it's only positive in 50% of Lyme patients, unfortunately. So you have a whole bunch of folks who may not be getting the appropriate treatment. And as the lady said in the prologue of that book, early treatment makes a big difference on this. If you start to come down with symptoms and you have had a tick bite, or if you have even been in the woods, and even if you haven't, you need to let your doctor or healthcare practitioner know that you're having all these symptoms, that you heard about Lyme disease, could it possibly be Lyme disease, and get tested. And then the usual treatment is antibiotics for 4 to 6 weeks. And there are different books that kind of talk about what types of antibiotics. The ones that I've been reading are by Dr. Horowitz, Richard Horowitz. There's one called Why Can't I Get Better, which is the subtitle is Solving the Mystery of Lyme and Chronic Disease. And it's usually a number of different antibiotics, especially if you have co-infections. So the problem with the tick is the ticks don't just carry Lyme disease, they can carry a lot of other things. And one of them in particular that's a challenge is Babesia. So Babesia is a malaria-like organism. It's a parasite. And your body handles immunity differently with a parasite than with a bacteria. So a parasite's like a worm. And remember when Lyme disease when COVID first came out, people were saying people had a cytokine storm. That meant their immune system went too aggressive, and it actually damaged the organism itself. It damaged the lungs, and that's why people were dying. So as it turns out, if you have, let's say that you were in Africa or somewhere and you got a whole bunch of worms in your intestine, if we suddenly kill all those worms, they are foreign bodies, and your body would have too big of an antigen load, and your body would have a cytokine storm, and it might die because of all those toxins floating around. So the way that the body has evolved to handle parasites is it makes a lot of mucus, and it basically pushes the worms out of your gut on slime. So you basically eradicate them with more mucus and things like that. but it lowers your immunity. So if it raised it too much, you might have the cytokine storm. So now, suppose you have a parasite and you add a bacteria that's really a wily one, a really crafty one, like a spirochete, like Borrelia burgdorferi, like that's the spirochete that causes Lyme. So if it happens to be in a tick that already has babesia, and you get both organisms introduced in your body by a tick bite, the babesia lowers your immunity, and now the Lyme disease can go anywhere it wants because it doesn't have much immunology fighting it. It doesn't have antibodies. It doesn't have your T cells. Everything's kind of revved down so that you wouldn't have a cytokine storm, and that's probably why Lyme disease is such a big problem when you have co-infections with it. So anyway, back to how we're going to prevent this thing. We don't want to have a tick bite because we don't want to get Lyme disease. We don't want to get these co-infections. And the safest insect repellent seems to be picaridin, Picaridin. Now, before, we used to use DEET a lot, D-E-E-T, and that's very effective, but it also happens to be a neurotoxin, so you don't really want to be spraying it on your children or pregnant women or yourself for that matter. It does keep off insects. I remember when I was in Alaska with the Boy Scouts, we did do that, and it was very nice to get all the biting flies off of us with the DEET. But it's slimy. It also stains clothes. It affects rubber and leather and other things like that. So they were looking for a better insect repellent. And there's a brand called Ranger Ready, R-A-N-G-E-R Ready, R-E-A-D-Y. And that has 20% picaridin. Picaridin is an insect repellent that is made from the polyphenols of the pepper. It's what makes the pepper have a hot flavor, and somehow that is able to repel ticks, also mosquitoes. It lasts 12 hours. At 20%, it does just as well as DEET, and it's been proven to be safe on pregnant women, and the EPA says it's safe for pregnant women and children, and the CDC recommends it even. So we don't always talk about CDC recommended stuff here, but the picaridin is what I really want to emphasize. If you want to take home one thing from this show besides learning about neurotherapy from Kim, it's to get some insect repellent that has picaridin 20% and use it whenever you're going to be outdoors, especially around your ankles. If you wear shoes and socks, the ticks can crawl up your socks and get onto your skin, so put a little bit around there. You just need to be aware. Some people say, well, we don't have any Lyme in Texas. But if you really do the testing, again, if you do standard testing, that may be true. I have a relatively small medical practice in my standard medical practice, and I think I have 10 Lyme patients. So that's a small piece of Texas right there with a lot of Lyme patients. And how do we find it? That's a good question. So if we go by the ILADS, the International Lyme and Associated Disease Society guidelines, you have to use different tests that are more specific for Lyme disease. And in my office, we use IGeneX. IGeneX, it's expensive. And the problem is, if the CDC doesn't agree with that test, then insurances will say, well, we're not going to pay for that because that's not the standard test. And so, again, the standard test is a Western blot, but it's only 50% accurate. So you need to be saving up and have some money on reserve just in case you get a tick bite, and you need to get a more definitive test because the test for Lyme disease and associated diseases through IGeneX costs about $2,800. So it's expensive, but then you at least have an answer of why you may be feeling so bad, and then you can take, again, we're not doing that lab test here for you at O3+. I'm recommending that if you continue to have symptoms, you ask your doctor if they might order that because they need to be managing your health care. We're here as complementary health care. So what do we have to offer for Lyme? Typically, if your doctor finds that you did have Lyme on a specialized test, They may refer you to an infectious disease doctor, or they may refer to those books that I was talking about from Dr. Horowitz or other information from iLabs and put you on some antibiotics. And if the antibiotics don't work, one of the other things that seems to help is high-dose ozone therapy. So there's a doctor out in Santa Rosa, California, and that's Dr. Robert Rowan. And he has been using ozone for quite some time, and we actually learned how to do high-dose ozone therapy in his clinic. That was from, who's the Austrian guy?
Dr. Lahotny.
Yeah, from, what was his first name? Anyway, Dr. Lahotny. Dr. Lahotny came up with, he actually was using high-dose ozone. So what it is again, we have to have a fancier machine with a vacuum ability on it. So we have your same IV in your arm, and we turn on the machine, and it sucks your blood up into a glass bottle, ozonates it, and puts it back in you. And then we do it 10 times. So you get 10 times the ozone dose, and Lyme disease does not seem to respond as well to lower doses of ozone. We've tried it a lot. People feel better for maybe a day, and then it comes back. So Lyme disease is a tough one. Again, why is Lyme so tricky? Lyme can be in 3 different forms. It can be a spirochete, which is like a little spiral bacterium. It can be in a spore form, and it can be as a plasmodium. It kind of looks like an amoeba. And it can hide in different parts of the cell. It can be in the bloodstream. It can hide in the wall of your arteries. It can be all over the place, and it's very efficient at hiding from your immune cells. It also tends to knock down some of your natural killer cells. One of the tests that we use sometimes, or that your doctor can use, is called a CD57. If your CD57 count is low, it's frequent, and you have a diagnosis of Lyme disease, it usually means that it's still active. Some people have asked, can you ever get rid of Lyme disease? And I'm not really sure you can, but by the same token, do we ever get rid of all the bad organisms in our body? I don't think we ever do. I think we suppress them all. I think our body is very effective. It's just like, when you had chicken pox, you used to have the chicken pox virus hidden away in your body, but you keep it sequestered. You keep it hidden away and under control, and that's the way we live with organisms in our bodies all the time. So with Lyme disease, I think I hope that we can get rid of it. I think you can probably get rid of it if you get antibiotic treatment right away, but it's so hard to diagnose early on that a lot of times we end up with more chronic Lyme disease, and that's where we can help you with the 10-pass. So I'm going to play a little video here an audio from Dr. Rowan. Hope it comes out where you can hear it well enough. Otherwise, I'll post it on our webpage for the radio show. The webpage is www.DrFrankCuttingEdgeMedicine.com. That's DrFrankCutting edgemedicine.com. And also, from there, you can get links to our ozone clinic, which is o3plustx.com. And again, our phone number here for more information is 210-558-7778. So without any further delay, let me play this little audio of a young man who came to Dr. Rowan's clinic about 5 years ago and got the 10-pass treatment for his Lyme disease.
Okay, so this is a recording from a YouTube video from Dr. Robert Rowan, who is in Santa Rosa, California, and he does the 10-pass high-dose ozone therapy. It's a blood ozone therapy that we do here at O3 Plus as well. And we're going to be listening to the story of an 18-year-old young man with Lyme disease. And we'll see how he did with these. He had 10 pass treatments, which is fairly intensive, but it worked well. He had come to the area for college, but was so sick he wasn't sure he could do college, and antibiotics had failed him. He had been to see other physicians as well. So here's his story.
Today's date's October 27, 2015. We're here with Julian. Hello. And Julian is in his late teens, and you can see he's a strapping young man. And you would think he would be very healthy and energetic, but he came to see me more than a month ago, wiped out. Is that correct?
Yes, I was extremely exhausted. I had no energy. I had tons of brain fog, not feeling good.
And you were diagnosed with Lyme disease, correct?
Yes, I was diagnosed. I went to a doctor, and he told me that the first time I went to a doctor and asked to do something about it, we could have taken blood tests, but we didn't. And then I got diagnosed eventually with it, and it was in the latter stages. So I had a lot of trouble, and I came to Dr. Rowan because I came up to go to SSU for school. And ever since, after a month of treatment, I feel great. I feel a lot better. A month of treatment, the vitamins he gave me. Also, I went on a diet. It's a lot of work, but it's worth it.
I really appreciate you sharing this. I may post this on YouTube.
Of course.
Thank you. A couple more questions.
Mm-hmm.
How many ozone sessions have you had?
I did 10 pass, so that means 10 times, and each time you do it, it goes 10 times up.
How many times have you been in?
And I've been in, I think, 10 times. Right?
10 times.
Yes.
Okay. So that did fairly well for you.
Yes, definitely.
Okay. And you had been treated by other people too, have you not?
No, just recently, like right before I came here, I got a new diet that I was supposed to do. So no gluten, no dairy, I had a lot of things off of my diet. And I think that also, contributed.
I'm sure it did, because we stress diet first.
Of course.
We do supplements, and you've been taking them, and we do the ozone therapy
yes.
as well. Well, I'm delighted that it worked that well for you. When you came in, if you had 0 points of energy and 10 is what you would like to live with, what do you give me now?
I give you a good 8.
A good 8. That's terrific. That's in a fairly short period of time. And remember, when you came in, there were questions about whether you would even go to school here because you were so fatigued. I think even your mom was worried about it. Is that correct?
Everybody was worried about it. I didn't think that I was going to be able to go to school. And that's why I came to Dr. Rowan in the first place, because I thought I needed somebody to help me, and I need to find some other method. And you know what? It's not always there in conventional medicine. You just got to go for something different. And that's what I did.
And you're doing well in school?
Yeah. I'm doing pretty well, considering that I was going through the treatment while in school. I have to say, it's been tough, but, I got over it.
Good. Thanks.
Mm-hmm.
And you can play sports and do everything you want?
Oh, yeah, sports, definitely.
I love it. Thanks very much.
Okay, so interesting story. I think the best thing I can tell you is there is hope. There are so many of my Lyme patients who really feel frustrated when they read about things. If they go to specialists and they say, you don't have Lyme, there's nothing we can do for you. And some of that, again, is because they didn't do the more definitive treatment. But even with that, sometimes they put you on the antibiotics and you get better and then it relapses. And it's very frustrating if they say, well, that's as good as we can do. We might be able to add to that. So again, our clinic, O3 Plus Texas, is a complementary medicine clinic. We try to, holistic medicine is bringing everybody together. We will not be your primary care physician. We will be adding to whatever your primary care physician can do. Hopefully with their consent. You're the patient, you get to be in charge, but you need to let everybody know what you're doing. We have nothing to hide here. We have good documentation that it helps some people. It doesn't help everybody, but it definitely helps a lot of people, and there is definitely hope. And, there's a lot of ways that ozone can make your immune system better. We could go over all the science with you, but basically, sometimes you just have to try it out and see. So if you had to do the 10 pass, that takes, about an hour and 30 minutes, something like that?
Yeah, anywhere from 45 minutes to an hour and a half. Okay.
It depends on the access of your vein, how well the blood flows up into the machine and then back out. It's fairly expensive, right? Close to $1,000?
Correct. Without a package, we do packages to bring down the price some. It's a very involved treatment with an expensive machine, one-on-one care, and it takes a little while.
Yep, we got the machine out of Germany. We have to get all the supplies out of Germany. We had to be trained on it. If you're going to go get treatment somewhere for some of these specialized treatments, it's a good idea to make sure that the people have been trained. If you come into our clinic, you can look on the walls, see our certificates, see the pictures of us with all the the trainers rather. And we're trying to add something here to South Texas that hadn't been here before, which is more complementary medicine techniques, just in case you don't get completely well with your traditional and standard medical care. So let's see, we have about another 10 minutes or so to go. Again, you can hear that Lyme disease treatment can be quite extensive and expensive. So don't get it if possible. That means that you need to be using some kind of insecticide. Again, for Lyme disease prevention, Lyme Disease Awareness Month, please have insecticide at all your doors at your house so you can remember when you're going out, you squirt a little bit around your ankles and try to not get the ticks on you in the first place. Again, we have at our clinic samples of this Ranger Ready. You don't get the sample, but you can at least look at it, and you can buy them on Amazon. Ranger Ready repellent has picaridin 20%. It comes in 3 scents, night sky scent, Ranger orange scent, and amber scent. Anyway, you can kind of spray them and see which one you like, and then you can order the right one. We'll have them here so you can check them out once you become a patient here. And we're staying ready to help you with any of your more complicated conditions that other people haven't been able to solve for you, or come in with a simple one. We like the simple ones as well. It's a lot easier that way. But again, what we do in the clinic is we build up your immune system so that you can handle whatever comes your way. Again, if you're doing everything at home, sleep, nutrition, exercise, detoxify, de-stress, and then come on in here and we can help you out if you need more than that. We detoxify in our ozone sauna or in the infrared sauna. We can help you get rid of some pain with the pulsed electromagnetic field therapy. If you need help with your exercise, we have exercise with oxygen therapy. If you don't know why you're not doing well, we can do the bioenergy testing that we've been trained by Dr. Schallenberger, who came up with that technique, so we can figure out what modalities would help you the best. And then if you're having pain, again, that robs your body of energy to heal or to stay healthy. And Kim has been talking about neural therapy. So again, back to the beginning, we were talking about complications of COVID vaccine or COVID infection. And if you have pain or shortness of breath or other problems from coronavirus, either the infection or the vaccine, we may be able to help you get past those. Mm-hmm.
Yes.
And so what does it take to get into the clinic? How do we get in here?
You call our lovely office manager, Miss Terry, and make an appointment for a new patient consultation. The new patient consultation is $175. You'll sit down with me for about an hour and a half. We go through your medical history, your current symptoms, your current desires for coming into the clinic. We'll go through an explanation of ozone, how the ozone works in your body, a description of the different treatments that we think will help. We'll come up with a care plan together during that consultation, and most people do a treatment that day. We do require 3 labs that we do here in-house for $20. If you think you've had a complete blood count or metabolic profile in the 2 months before coming in, you are welcome to bring that in. The 3rd lab that we do is a G6PD. It's a pretty unknown lab. It's an enzyme that if you're deficient in it, we can't give you too much oxidative therapy. So we check everybody to make sure they're on the up and up. It's a very rare disorder, but legally, we find that protective to know it on everybody. And most people do a treatment that day. We do those at 9:30 in the morning or 1:30 in the afternoon. Most people are here for about 2.5 hours when they come in for the new patient consultation, less if it's someone coming in for knee pain. The ones that take the longer are the autoimmune disorders or Lyme disease or the unknowns.
Mm-hmm. So it sounds rather involved, and it is. We will strive our best to keep you safe and moving along towards better health. And to do that, we have to know your whole medical history. We've had people come in, they looked up on the internet, they said, oh, I need this particular treatment, and they walk in, they do not want to tell Kim anything, they just say, I want to get this. We don't do it that way. That's not safe. We need to know exactly what your story is before we suggest anything. And a lot of times, there are sometimes we have said, we don't think that we can help you. We'll try it if you want, but based on your story, we may not be able to help you. The beauty of ozone, though, is it is such an amazing modulator of your body that it can usually help when other modalities have not helped. Yeah. So we've got about 1 more minute.
I'd like to share a case study, Dr. Frank.
Okay, 1 minute.
All right. I've got a 70-year-old female that was in the hospital for COVID. She came into us. She was extremely fatigued and dragging, hardly able to walk, unbalanced, and brain fog. She came in for the IV ozone, the major autohemotherapy. We also added the UV light, a Myers cocktail with extra vitamin C and amino acids, and an immune system jumpstart. 3 days later, she was on the upswing. She's been coming into us weekly since then, getting the IV ozone with 25 grams of vitamin C. Her brain fog's much better. After 8 treatments, she was normal, and she continues to come on her 10th treatment.
Beautiful.
Very happy with us.
That's what we want to see. People get back to normal. Well, this has been Dr. Frank Cutting Edge Medicine, brought to you by O3 Plus Texas. Our number here is 558-7778. Once again, thank you for listening today. Don't forget, Facebook Live tomorrow, Monday, May 10, 7 p.m., my interview with Colin Egglesfield on Coffee with Colin. And on this Mother's Day, be sure you visit with your mother by phone, in person, or if she's not with you anymore, connect with her spiritually and thank her for the gift of your life. See you next week on the Dr. Frank Cutting Edge Medicine Show.